My name is Misty Austin, and I'm here with my daughter Piper, who was born with a congenital heart defect. We are local Go Red for Women ambassadors, and we are joined by Piper's cardiologist, Dr. Stanley Wright, with Capital Pediatric Cardiology. Hi, Dr. Wright.
Hi, good morning. Hi, Piper.
Good morning.
Good morning.
As you know, Dr. Wright, Piper was born with a heart defect. How common are congenital heart defects in the United States?
So they're actually the most common type of birth defect. And if you look at all babies born, approximately 1% of babies born have some type of congenital heart defect. And so that comes to about 40,000 babies a year in the United States are born with some type of heart defect.
Okay. How early can a congenital heart defect be identified?
Well,
and are there warning signs that doctors and nurses can look for?
Yeah, and as you know, most of the heart defects that we deal with can be identified during pregnancy. Some cannot. And then the signs or the symptoms that nurses and doctors look for include heart murmurs, or sometimes babies are born with abnormal oxygen levels or abnormal breathing patterns, or as they sometimes mature over the days or weeks after birth, they can have difficulty feeding and growing.
What treatments are available for different types of congenital heart defects?
So for some children, fortunately, they may not need any treatment. And then for some, it'll be a combination of adjusting their feeding pattern or their calories that they take in. For some, it'll be also medications that help them kind of deal with the symptoms or the consequences of the heart defect. And then for others, it may require a catheter procedure. That's something that's done through blood vessels in the leg, that then we pass catheters up to the heart and can do procedures through those catheters. And then for some children, it'll require a surgical procedure. And then there are different types of surgical procedures depending upon the child's defect.
Okay. The American Heart Association's Go Red for Women movement is all about living fierce and supporting women's heart and brain health. What advice do you have for living a happy and healthy life for young girls like Piper or other young girls born with a congenital heart defect?
I think it's a great question. And I really think that's a very significant thing that we need to all address when we look at these children. I think what I would say to the child as they mature and get older, and teenagers that I see or older children that I see, that know you are loved.
Yeah.
There's truly an army of people that are with you, behind you. That includes your family, your parents. But also know this does not define who you are.
Yeah.
And you are more than the name of some heart defect. So, I love me too. So I love the be fierce approach and go live life and adventure. So I think in addition to knowing that you're more than a diagnosis, also you're courageous, you're tough, and that you're resilient, but also maintain your health. Make sure you are attentive to eating well, eating healthy, exercise, be active, and maintain your follow-ups with your physicians and your primary care providers.
Yeah, I like that. I feel like that's how for one, I felt so much love from everyone in the hospital when Piper was in the hospital. We try our best that she's not just a child with a heart defect. She's Piper. And she's amazing, and she is fierce.
I do a lot of exercise, like I kind of do, because I have my tennis shoes outside on my porch, like doing some exercise and stuff.
Good.
Thank you, Dr. Wright, for taking the time to join us.
Oh,
We
thank
really-
you.
Thank you. We really appreciate you helping us raise awareness to support families with heart children like ours.
Thank you.